We wanted to investigate the impact of the pandemic on sexual assault survivors, but we learned that data on this topic is scarce. Focus investigative reporter Paula Vassan created her own survey to examine the scope of the problem. She's bringing us tonight how healthcare industry sources are reacting to it.
I didn't know what to do.
That's Olivia Landis telling us about her experience after being sexually assaulted by someone she knew. In our report from last week, we told you how she went to a local hospital to get a forensic exam. The exam collects potential evidence using a sexual assault kit, also known as a rape kit.
I was waiting for 6 to 7 hours just for people to come and talk to me.
But after waiting at the emergency department, a forensic exam was no longer an option. The exam must be done within 96 hours.
And they said, no, too much time has passed.
She says it meant she was unable to successfully press charges against her attacker. We wanted to know if Olivia's experience was an isolated incident. We developed a survey, working with Layla Kashan with the Kentucky Association of Sexual Assault Programs and Deb Campbell with the Kentucky Hospital Association to distribute it to their hundreds of members. We collected anonymous responses from 64 sexual assault nurse examiners, emergency care providers, and other healthcare workers who have met people like Olivia during the pandemic. About 21% of respondents told us since the start of the pandemic, they've witnessed sexual assault survivors being turned away after requesting a forensic exam. Nearly 3 in 10 told us they've seen increased wait times for sexual assault survivors to receive these exams.
Is that sexual assault kit the most important piece of forensic evidence if someone wants to press charges?
Absolutely.
Campbell says she's advocating for nearly $5 million from the state government to make sure hospitals are equipped with nurses specifically trained to deal with sexual assault.
We just don't have enough nurses, period.
We also brought our results to Kentucky lawmaker Joni Jenkins.
I would hope that a story like this would get out information.
She tells us she's advocating for more funding for domestic violence, rape crisis, and child advocacy centers. Her goal, she says, is prevention.
So that we can focus not just on those immediate crisis programs, which are really important, but to do some more preventive educational pieces.
Do you think sexual assault survivors have the resources they need to get help?
I think they do, but I'm concerned about getting that message out.
Olivia Landis, the domestic violence survivor you heard from earlier, told us after her sexual assault, she didn't know what to do. If you're a survivor of sexual assault and need help, you can call a national hotline, 800-656-HOPE. You can also find the full results of our survey, along with local and national resources on our website, WHAS11.com. In the studio, I'm Paula Vassan, WHAS 11 on your side.